Nadia Bilchik is a television news anchor, keynote speaker, author, trainer, and communications consultant.
19 number one best-selling.
You have been nominated and won so many awards throughout your careers.
She has a wealth of experience interviewing and consulting with well-renowned figures, celebrities, and corporations. Nadia speaks on how to get people to like you, trust you, and want to do business with you.
Over the last few weeks, the entire world has been monitoring the treatment of your grandfather, Nelson Mandela. And my job was to introduce it and provide.
With topics like leveraging the power of your personal presence, networking for success, and lighting the fire. Nadia Bilchik.
And today, I am joined by a world-renowned endocrinologist and metabolism expert. In fact, she's known as a global diabetes visionary. Resa Levetan, so appreciate you being here.
Thank you, Nadia. I'm so happy to be here.
Now, diabetes impacts many, many people and has during COVID. Won't you tell us what you found has happened to people who have pre-existing conditions, and how do we prevent this horrific disease getting even worse during COVID?
Unfortunately, people with both diabetes and prediabetes are at greater risk for COVID. And unfortunately, they have worse outcomes if they do get COVID because elevated blood sugars. And that means even if you have prediabetes, you are at an increased risk for worse outcomes. And our research group has even shown that if you have prediabetes or diabetes, you have worse outcomes, not only for infections like COVID, but heart attacks, strokes. So the goal really is to improve your sugars if you have diabetes. And if you have prediabetes, we have been part of not only this study in the US, but a similar study in Finland and China, which showed that 30 minutes a day of aerobic exercise, along with modest weight loss, can reduce your risk for getting diabetes by 70% or more.
So there are people who are joining us today who may not even know that they're diabetic. So First of all, what signs do we look for? And then what can we immediately do? And if we can, for a moment, focus on diet.
Right. Well, Nadia, as you may know, there are 360 million people on Earth with diabetes. And then there's another 700 million with prediabetes. So 1 billion people on the planet who are at higher risk for getting COVID. And the reason is with higher blood sugars, the immune system just can't fight off infections as they would if the sugars were lower. The most important thing is if you have a family history of diabetes anywhere in the family, get tested. The name of the test is an A1C test that lets us know how your sugar has been over the last 3 months. And if you have diabetes, you need to make steps to improve your health. And generally, exercise, diet, but those are hard things to do. And you have to be ready and you have to be willing. And I've learned after all these years that you need to set your own goals and decide what you want to do. What are your steps? And it can't be your children or your parents or your spouses that say, stop eating that piece of cake, or it has to come from within. I think one of the things I say to my patients, and I don't have a lot of dietary restrictions, but one thing people aren't as aware of is something as simple as fruit juice or sugar soda has a lot of extra sugar, which can raise the sugar in the blood. So I usually say to people, no fruit juices or sugar sodas, and you can have unlimited natural fruits and vegetables. And that's a first step.
And then in terms of refined food, so much of our food has hidden things in that
Correct.
we don't even know. So again,
Right.
what advice? Now, we're talking to different people with different levels of
Right.
knowledge around food.
Right.
So reading
Right.
labels.
Right. Labels are not simple to even read, and they're a little deceiving. I think if you're going to look at a label, look at carbohydrates. Now, again, carbohydrates are in fruit and vegetables, in almost everything. So I think it's important just to get a grasp of, are carbohydrates in what you're eating, and to potentially limit those. Now, obviously, we don't want you to limit fruits and vegetables, but you may find that there are other sources of high carbohydrates, cereals, even oatmeal. So look at carbohydrates and be aware of the areas where you're going to see that you're taking in. There isn't a set limit, but you can see, I was just showing a patient that even a small little can of grape juice had 29 grams of carbohydrates. That's a lot more than she realized. So just become aware of where you're getting the carbohydrates in. And there may be areas to cut. So I generally say to patients a simple rule. I mean, nothing simple when it comes to diabetes, but if you get on the scale and take your weight in pounds times 10, that's the amount of calories a day that your body requires. And if you want to make a cut and lose a pound a week, that would be a deficit of 500 calories a day. That can come from extra exercise calories, or that can come from a reduction in food intake.
There's so many diets out there,
Right.
keto diet
Right.
and low
Yeah.
carb this. I mean, your thoughts around that in controlling diabetes if you have it?
Well, that's a tougher question. We know that the fad diets don't work. Most diets don't work. And I think as part of the process, you have to realize you're going to make some steps forward, you're going to go backwards, and it's important to stay on track. There are people who really like structured diets, but typically, if you're on a keto diet or a liquid protein diet, when that ends, you're going to gain the weight back. So I say to patients, think about what areas you can make some reductions: fruit juices, sugar sodas, some desserts, and make sensible cuts that you could keep for a lifetime. And that doesn't mean that you can't go off the diet. I don't generally limit any foods that a person loves. That's a recipe for a disaster. But think about where you can make some cuts. I know here in the States, you go out to restaurants and they're more apt now to put the calories on the menu. And I was pretty shocked. I actually took a picture of this. There was a really delicious butter cake with some ice cream and bananas, and they actually put the calories as like 2,700, which immediately I said, I was going to order it. No. So again, just for people to know, there's 3,500 calories in a pound, and there's 7 days in a week. So if you want to lose a pound a week, you need to make a 500 calorie cut a day. And that's one of many concepts and that may work for some people, might not work for other people. But I think if somebody can just take a look to see what might be things, if they do want to start exercising, that can be walking. I generally tell my patients to start with 1 minute or 2 minutes a day and go build up slowly. A lot of people have exercise equipment that they don't use, to consider that, or walking, just walking around, whether it's up steps, around your neighborhood, whatever. Start with 1 or 2 minutes so it's not overwhelming and it's something that you can do, and build up slowly. And as I said before, there are 3 studies, the US, Finland, and China, which all demonstrated that 30 minutes of aerobic exercise a day, and that was not jogging or it was not doing anything crazy. That was just brisk walking. And that was associated with up to a 70% risk reduction in developing diabetes.
And what about medication? So do some people think, well, once I take the medication, something like glucophage being one or other medications, now I can eat whatever I want?
The answer to that, maybe some people think that, but it's much more complicated than that. And a medicine like glucophage and the different medicines work differently. All of the medicines work in conjunction with lifestyle modifications. Now, in the study that was done in the United States on diabetes prevention, just to let you know, with glucophage, that the people that only got glucophage and didn't make the lifestyle modifications, building up to 30 minutes, and it was only 30 minutes 5 days a week. So we let people off a couple days a week. But that the patients who were in lifestyle modification, they reduced their risk by 70%, whereas the people who got glucophage and didn't make lifestyle changes only reduced their risk by 30%. So you can see that it's really a full court press in terms of trying many things. And I give my patients who come in with new onset diabetes the option. Do they want aggressive medical management? Do they want to try lifestyle modification? Do they want to do both? And it's not a simple answer. And I think what I've learned over the years is just accepting patients where they're at and working with them. And I think it's important. You show up, if they come to my office, that's the first step. And that I think that's great. And so who's ever listening and they want to make one step, whether that's cutting out fruit juices, whether that's starting to walk 2 minutes a day, I think that's awesome. And I think that just setting your own goals and not listening to people telling you this or that you must do something or stop eating the cookie. I'd say don't deprive yourself of much, but make wise choices.
Excellent sound advice. And last question is alcohol. Impact on alcohol, because we know alcohol consumption during COVID increased. Right. Dr. Resa Levetan, your thoughts on that?
Alcohol, like blood sugars, can reduce the immune system's ability to fight off infection. So again, you're putting together two, if you have an elevated blood sugar, and that used to be, see elevated blood sugars in diabetes, in prediabetes, and again, combining that with alcohol is going to be another situation to reduce your body's immune system to attack an infection. Now, I want to also bring up that you talked about so many people have unrecognized diabetes. They don't know they have the disease, and that's very common. Our group published on how people that came into the hospital with heart disease, heart attacks, many of these people who had high blood sugar actually had diabetes and didn't realize they had it. And that's often the first time we make a diagnosis, is when somebody's in the hospital for another condition. So the most important thing is have your doctor check. Ask for the A1C. And one of the little phrases I use, A1C, get it, know it, lower it.
Dr. Resa Levetan, thank you so much for your time, advice, and expertise. As I said, she is known as a global diabetes visionary and is committed to ending diabetes worldwide.
Thank you. Thank
to
you.
all of our friends from Atlanta, Georgia, to Johannesburg or Cape Town or Durban in South Africa, thank you so much. And Resa, so appreciate your time.
Thank you, Nat.